Preparing for the CNA exam doesn't have to feel overwhelming. This clinical skill demonstration is one of 22 free videos we've created to help you understand the process. If you're serious about passing the Florida CNA exam, GatorCNA On Demand SurePass gives you the structure, the tools, the support you need to pass with confidence. Sign up for a free preview at www.GatorCNAOnDemand.com to get access to 3 full modules and see why 92% of our students pass the state exam.
This skill is provide perineal care to a female resident who's incontinent of urine. The candidate is asked to provide perineal care to a female resident who's incontinent of urine. The resident is lying in bed on an underpad and is wearing a hospital-style gown that is dry. A mannequin is used for the role of the resident. Follow along in your student manual. Start each skill the same way by knocking on the resident's door. Greet the resident by their preferred name, introduce yourself, and describe the care you're going to provide. Hi, Miss Lilac, how are you doing today? Good. My name's Lizzie, I'm your nursing assistant, and today I'm going to provide you with some peri care. Is that okay? Great, let me go wash my hands and I'll be right back. If this was the first skill on your care plan, you'll need to physically wash your hands at this point. If this is the second or third skill on your care plan, turn to your NAE and say, I will wash my hands at this point. When gathering our supplies, you can take the overbed table with you to the cabinet or dresser, or you can walk back and forth from the cabinet and dresser to the table. If you choose to do this, just remember not to hold the clean items against your dirty uniform. There's not a lot of room on the overbed table, so we always want to be strategic with how we place our items. The first item that we're going to grab is a barrier towel. Take the towel and unfold it on top of the overbed table. This is going to protect our table from any spills of water or any used linens that we have throughout the skill. Next, grab a bed pad. We're going to leave the resident with a bed pad since this is how we found them. Next, you're going to grab a drying towel and a privacy towel. We're going to grab another bed pad. This will be used while we're cleaning them. The facility that you test at may have a disposable or reusable bed pad. If you have a reusable bed pad, take this to the hamper at the end of the skill. If you have a disposable bed pad, take this one to the trash. And finally, we're going to get 4 washcloths. 1, 2, 3, 4. These will be used for washing and rinsing the resident. Now we're going to go to the dresser to continue getting our supplies. We'll need a basin to fill with warm bath water. And we'll need soap for cleaning the resident. We'll also need a set of gloves. Now that we have our supplies, we're ready to prep the resident. One of the first things we're going to do is put on our gloves. We're about to remove the soiled bed pad and we don't want to touch that with our bare hands. So put on your gloves one at a time. To remove the soiled bed pad, we're going to ask the resident to scoot towards us and roll away. Now remember, since your resident is a mannequin, you'll have to do all the heavy lifting. All right, Miss Lilac, on the count of 3, could you please scoot towards me? 1, 2, and 3. Thank you. Could you please bend the leg closest to me? And raise the arm that's further away. Thank you so much. And could you please place this arm on your belly? Thank you. Now on the count of 3, we're going to roll away. 1, 2, and 3. Great. From here, we're going to roll up the soiled bed pad and get ready to put in place the new clean bed pad for cleaning. Roll the bed pad about halfway and tuck it underneath the soiled bed pad. We're going to ask the resident to lay back down, and we'll walk around to the other side to finish removing the soiled bed pad and finish replacing the new bed pad. All right, Miss Lilac, if you'll please lay down on the count of 3. 1, 2, and 3. And could you please recenter yourself? 1, 2, and 3. We will once again ask our resident to scoot towards us and roll away. This will expose the bed pads and allow us to finish removing the soiled one and replacing it with the new one. All right, Miss Lilac, once again, if you'll scoot towards me on the count of 3. 1, 2, and 3. Thank you. And if you'll please bend the leg closest to me and raise the arm that's further away from me and place this arm on your belly. And on the count of 3, we're going to roll. 1, 2, and 3. Thank you so much. We'll now finish rolling up the used bed pad and rolling out the clean bed pad. And lay back down. Make sure your resident is reasonably covered and let them know you're going to step away to take the used bed pad to the linens or the trash. Can you please recenter yourself? Thank you. And I'll be right back. Next, we're going to get a privacy towel on the resident. Pull down the sheet to about halfway down the legs. Take the privacy towel and lay it across the resident's gown. When we come back with warm water, we're going to end up rolling the gown into the towel to keep it dry, but expose the genitals as that's the area we're about to clean. But for now, keep them covered. We're now going to fill up our basin with warm bath water. We'll fill it up about halfway. Let your resident know you'll be stepping away. I'll be right back. I need to get some warm bath water. Now that the basin is about halfway filled, turn off the water. Ask the resident to test the water before you start bathing them. How does this feel? On test day, the NAE will reach across and feel the water to make sure it's the correct temperature. Take your washcloths and throw them into the basin to let them get wet and soak up that warmth. We're now going to roll up the privacy towel to expose the area we're about to clean. We're now ready to begin cleaning.
Do you want a consultation with a CNA classroom instructor? When you enroll in the full version of our course, SurePass, you get exclusive access to an instructor to help navigate the testing process, our course, and answer any questions you may have. Sign up for a free preview at www.GatorCNAOnDemand.com to get access to 3 full modules and see why 92% of our students pass the state exam.
We're now ready to start cleaning the perineal area. We'll start by taking one washcloth from the basin and wringing it out over the basin. We don't want to drip any water on the floor or on the bed. Take the washcloth and fold it into fourths. Using this technique allows us to have 5 clean surfaces that we're going to need for cleaning the peri area. Here's one clean surface. We'll then pull this down to reveal a new clean surface. We pull this one down and we have another clean surface. We pull it down and another clean surface. Then we flip it over and this is our 5th clean surface. We're going to need to put soap on all 5 surfaces. Rub the washcloth together to create a lather. When you start seeing bubbles, you can then start cleaning. Make sure when you're doing this, you're not doing it over the basin, as we don't want any soap to get into our clean water. Using your folded washcloth, use the first surface to clean down the middle of the labia. Spread with your thumb and index finger and do 1 wipe from front to back. Hold this down to reveal a new clean surface. Clean from front to back. Pull it down and clean the other labia front to back. Hold this down and we're now going to clean 1 groin. And using our back side, we will then clean the other groin. We can now set this washcloth to the side. We're now going to rinse. We'll take another washcloth and wring it out over the basin. No soap this time. We'll follow the same folding technique and same cleaning pattern to wash away all that soap. Use your thumb and index finger to spread the labia and clean down the center. Reveal a new clean surface and clean 1 labia. Reveal a new clean surface to clean the other side. Use the 4th surface to clean the groin, and the final 5th side to clean the other groin. You can now set this washcloth to the side. We're now ready to dry. We're going to be using the same cleaning pattern as before, except this time we're going to pat dry. Get your drying towel and find a clean area. Make a little mitt and wrap up the rest of the towel to maintain control of it. Now, because we have to use both hands to spread the labia, you can rest the drying towel on the privacy towel or on the bed pad. Spread and pat dry. Find a new clean area. Pat dry. Again, always going from front to back. Clean the groin. And the other groin. Find a new clean area of the drying towel and lay it on the table so you have a clean surface next time you need to dry. Next, we're going to have to clean the buttocks, so we're going to ask the resident to roll over to their side once again. To turn the resident on their side, once again ask them to scoot towards you and then roll away. All right, Miss Lilac, on the count of 3, could you please scoot towards me? 1, 2, and 3. Thank you. Prop this knee up and lift the hand further away from me. Take this hand and place it over the belly. And on the count of 3, we're going to roll. 1, 2, and 3. We typically want to keep our resident covered as much as possible, but since we're cleaning the butt, it's okay that they are exposed. We're going to take 1 washcloth and wring it out over the basin. We're going to use that 4-fold technique once again. This time we're only using 4 surfaces, so we're going to put soap on all 4 of those surfaces. 1. Scrub the washcloth against itself until you start to see bubbles. Once you have a nice lather, we're going to clean the buttocks. Our first clean surface is for cleaning up the crack, again going from front to back. reveal a new clean surface, and we're going to clean one butt cheek. Reveal a new clean surface again and clean the other butt cheek. With our fourth surface, we're going to clean up the crack again. You can now take this washcloth and set it to the side. It's now time to rinse. We'll take our last remaining washcloth, wring it out over the basin, and rinse away all the soap. We're going to be using the same technique that we used when we were washing. Go up the crack and get a new surface. Clean one butt cheek and get a new surface. Rinse the other butt cheek, and we will clean the crack once again, removing all soap and bubbles from the butt. You can now set this to the side. Take your drying towel, and we're going to pat dry in the same pattern we just rinsed. Up the middle, get a new clean surface. One cheek, and a new clean surface. The other cheek, and a clean surface, and up the middle. You can now take your drying towel and set it on the table here. We're now ready to start cleaning up.
Do you learn better in an online course instead of YouTube? The full version of this course, GatorCNA On Demand SurePass, includes access to full online modules that include lectures, practice quizzes, digital flashcards, and a mock exam to help you prepare for both the clinical and written Florida CNA exam. Sign up for a free preview at www.GatorCNAOnDemand.com to get access to 3 full modules and see why 92% of our students pass the state exam.
We'll start cleaning up by getting rid of the bed pad that we used for cleaning and replacing it with a new clean bed pad that we're going to leave them with. Roll up the used bed pad. Take the clean bed pad and roll it up about halfway. Tuck the clean bed pad under the used bed pad. You'll ask the resident to roll back down and recenter themselves. All right, on the count of 3, can you lay back down? 1, 2, and 3. Thank you so much. At this point, you can unravel the privacy towel and cover them back up with their gown. You can lay the towel on the bed for now. Walk around to the other side to finish removing the used bed pad and finish replacing the new bed pad. We will once again ask our resident to scoot towards us and then roll away. On the count of 3, can you please scoot towards me? 1, 2, and 3. Lift this knee, lift this arm, and place this arm on your belly for me. And on the count of 3, we're going to roll away. 1, 2, and 3. We're now going to finish unrolling the used bed pad and rolling out the new bed pad. Now, because the resident is incontinent, make sure they're not laying on their gown when you lay them back down. And can you please recenter yourself for me? Thank you. I'm going to step away and put this in the linens. I'll be right back. Now we're going to take the linens to the hamper. Let the resident know you'll be right back. I'll be right back. I'm just going to take this to the hamper. Now we need to clean the basin. Start by emptying all the contents into the commode. Take it to the sink to finish washing it. For further instruction on cleaning and drying this or any other basin, reference the How to Clean a Basin video located in the How To section of this course. We now need to put away our soap. Grab a barrier towel for the drawers and for the soap. Take the barrier towel to the linens as well. I'll be right back, Ms. Lilac. Turn to your NAE and remove your gloves. Throw them away. Now we're going to remove any furniture that we brought in and make up the bed. Make sure there's no big wrinkles that could cause pressure sores, and leave the bed made with hospital corners. Now you can move on to your final closing statements. All right, Ms. Lilac, is there anything else I can get for you before I take off for the day? No? You're good? No glass of water or TV show? All right, here's your call light, and please let me know if you need anything. If this was the first skill on your care plan, you'll need to physically wash your hands at this point. If this is the second or third skill on your care plan, turn to your NAE and say, I will wash my hands at this point.
Thanks for watching. Ready to go from preparation to certification? Our full course, SurePass, has everything you need to pass the CNA exam, including mock exams, study guides, and one-on-one support. Sign up for our free preview at www.GatorCNA On Demand to get access to 3 full modules and see why 92% of our students pass the state exam.
Thanks for watching GatorCNA On Demand. Don't forget to like the video, leave a comment or question, and subscribe to the channel for more support on your Florida CNA journey.